This is a human hand. This particular specimen belongs to a young adult Caucasian male. Now, you may ask me, how is my video different from all the other videos on hand anatomy? Well, I could tell you that's because I'm going to use my own hand for it, or I could tell you that's because I'm going to use a left hand. Now, this has absolutely nothing to do with the fact that I'm right-handed and that it would be pretty difficult to write on my right hand with my left hand. So no, it was a purely stylistic choice. Now, welcome to the channel, and for this video I will be representing bones with black and muscles with blue. So, starting, we all know that to get to the hand, we have the wrist joint here between the radius and the carpal bones. So, here we can see the styloid process of the radius and the styloid process of the ulna, which leads us to the distal radio-ulnar joint here between the ulna and the radius. The ulna does not articulate with the carpal bones, which is made only by the radius. So here we have a synovial joint, which I will represent in green, between the radius, the scaphoid, the lunate, and the trigetum. So here you have that O mnemonic. You can remember it through so long to pink, here comes the thumb. That's the traditional one, which is scaphoid, lunate, trigetum, pisiform, hamate, capitate, trapezoid, trapezium, and the thumb part. However, feel free to remember whichever mnemonic you have. If you know a better one, then please do let me know. And so, naturally, after the carpal bones, you have the metacarpal bones, which will, on their own term, articulate with the proximal phalanges in the metacarpal phalangeal joints. And so, here we have the proximal phalanges, the middle or intermediate phalanges, and the distal phalanges, which leads us to both the proximal interphalangeal joints and the distal interphalangeal joints, such as here proximal and here distal. Now, of course, the thumb has only two phalanges. No middle phalanx here, just the proximal phalanx and the distal phalanx. So, ulna, which is its styloid process here, radius with its styloid process here, the carpal bones, and the radiocarpal synovial joint, here the metacarpal bones, and the multiple phalanges, proximal, intermediate, and distal phalanges. However, this dorsal view is not the most seen one, so let's turn our attention to the ventral side. So, radius, ulna, the distal radio-ulnar joint, and the carpal bones. So, radiocarpal joint here, and so long to pink, here comes the thumb, or scaphoid, lunate, trigetum, pisiform, hamate, capitate, trapezoid, trapezium, and the thumb. So here we get our first metacarpal, and here are all the others, the second, third, fourth, and fifth. And here the phalanges, the proximal, intermediate and distal phalanges, with the proximal interphalangeal joints and the distal interphalangeal joints, as well as the metacarpophalangeal joints. And in these joints, we also find volar plates, which prevent hyperextension. So here we will see the volar plates between these joints, which are ligaments that prevent hyperextension. So here you can see I'm forcing against it and it's preventing my finger from hyperextending. Just like this, flexion, extension, and if it were to extend backwards, I would call it hyperextension. However, the volar plates here, ventrally, are preventing it from going backwards. So they would be like here. We also have collateral ligaments, which are meant to prevent sideways dislocation, lateral dislocation. So they would prevent phalanxes from moving outside of the finger axis. So let's talk muscles. When you look at the hand ventrally, you see two large muscle masses, the tena eminence and the hypotena eminence. You can see that these are the two most prominent areas. So here you can see the abductor pollicis brevis, which is meant to abduct the thumb, that is, spread it apart, take it further from the hand. We have the flexor pollicis brevis, which is responsible for flexing the thumb, the adductor pollicis, which is responsible for pulling the thumb towards the hand, adducting it, and the opponens pollicis, which is responsible for pulling the thumb towards the other side of the hand for the opposition movement. Now, please pay attention to the three different movements. Of course, abduction and adduction are naturally opposite. However, note how adduction is different, for example, from opposition. You can see it better from this view. When you are adducting, you are just pulling the finger towards the hand in the same plane, in the same axis. However, when you are opposing the thumb, you are actually making it cross the hand towards the fifth finger. So if you adduct the thumb, you make it touch your second finger. If you oppose the thumb, you make it touch your fifth finger. And you also have flexion. And so, in the hypotena eminence, we are left with pretty much the same thing, just on the other side. So, we have the abductor digit minimi, responsible for abducting the fifth finger. We have the flexor digiti minimi brevis, responsible for flexing the fifth finger. And we have the opponens digit minimi, responsible for making the same movement that allows the first and fifth fingers to touch. Now, if you have been paying attention, you will notice that between the tenar eminence and the hypotenar eminence, we form a kind of a canal. This is covered by the flexor retinaculum and is precisely the carpal tunnel, which contains not only the median nerve, but also the tendons of many flexor muscles. And so, if you want to take a closer look at these structures. By the way, you might want not to do this at home because it takes a long time to take off the ink. You will see scaphoid, capitate, and MH at the bases, and the transverse carpal ligament or flexor retinaculum. As a roof, we get the carpal tunnel here, through which we have the median nerve, as well as many tendons of the long flexors of the fingers. This is of particular clinical significance because any kind of swelling in the canal can compress the median nerve from a multitude of causes, from pregnancy to amyloidosis, therefore causing sensorial impairment on the first three fingers and lateral half of the fourth, and motor on the thenar eminence. The sensorial impairment, however, does not include the proximal part of the hand, since the palmar cutaneous branch of the median nerve comes off before the carpal tunnel. The median nerve also innervates the first two lumbricals. Analogously, the ulnar nerve and the ulnar artery also have their own channel, the Guion canal, which can also be compressed, a condition most seen in cyclists, leading to sensory impairment of the fifth finger and the medial half of the fourth. The radial artery is superficial to the carpal tunnel and does not cross any kind of tunnel in the wrist. The Guion canal is bound superficially by the superficial palmar carpal ligament and has its floor composed by the flexor retinaculum, continuing from the roof of the carpal tunnel. So, as we said, the median nerve innervates not only the lateral part of the palmar surface, as well as the thenar eminence and the first two lumbricals. The lumbricals also start at the flexor retinaculum and go around the finger to insert posteriorly. Each of the fingers has one, and the two most lateral ones are innervated by the median nerve, while the two more medial ones are innervated by the ulnar nerve. So what happens is when the lumbrical contracts, it flexes the metacarpophalangeal joints and it extends the interphalangeal joints. So it goes like this. Due to its insertion, when it flexes the metacarpophalangeal joint and extends the interphalangeal joints. Now, like I said, the first two ones are innervated by the median nerve and the lateral ones by the ulnar nerve. Finally, we have the dorsal interossei muscles, which are responsible for abducting fingers 2 through 4, and we have the palmar interossei muscles, which are responsible for adducting fingers 2 through 4. Finally, the ulnar and radial arteries, anastomoses forming a deep and a superficial palmar arches. If you've liked this video, please leave a like, because it's going to be quite hard to clean this up. Thank you very much for your attention, and good luck on your studies.